Hello everybody, this is Gary. Today is April 20th, 2022. It is 2:02 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my Coping with Schizophrenia blog entry for today. Today I'm doing pretty good. My right knee is still bothering me, but I am getting closer to surgery next week on Friday, April 29th. They're going to remove a damaged part of my meniscus in my knee. The meniscus is sort of like cartilage. It cushions the knee from a shock. And the meniscus in my knee is torn. So it hurts really bad. And they're going to either remove or repair or both certain parts of the meniscus. If it can't be repaired, they'll remove it. And there's also some loose cartilage that they're going to remove. I'll be on crutches for a few days, most likely. There will be some degree of pain. They will probably give me painkillers for 4 or 5 days. Opioids or opiates. Not too many, because obviously they don't want me addicted to them. But they'll probably give me a few days supply of opiates for the pain. And there will definitely be pain because I have to bear weight on my knees. I still have to walk on my knees. So there will definitely be pain after surgery. That's unavoidable. As far as my psychiatric symptoms go yesterday, my anxiety levels were pretty high. I did see my psychotherapist yesterday. And the meeting went well. I just told her what was going on, and I was filled with anxiety over the upcoming surgery. I told her that my paranoia levels were pretty high. My auditory hallucinations were pretty intense yesterday. My anxiety levels were pretty intense yesterday. My depression was pretty intense yesterday. But talking to my therapist certainly helped. I am going to see her one more time before surgery just because I'm under a lot of stress and she wants to see me a couple of days before surgery. Normally I would see her about once every 3 weeks, but because of what I'm going through, she wants to see me at least one more time before surgery. So I believe I'm seeing her on April 27th. I'm seeing my psychiatrist tomorrow. We'll be discussing my medications, of course. That's the primary reason for seeing a psychiatrist is my medications. I'm going to ask him to increase my Zyprexa that I'm allowed every day to calm down my paranoia, anxiety, and my auditory hallucinations. Today, things aren't as intense as they were yesterday. My anxiety levels are down. My depression isn't as severe. My paranoia is not as bad today as it was yesterday. My auditory hallucinations are calmer than they were yesterday. So I'm doing better today than I was yesterday. Sometimes just seeing my therapist and talking to her is enough to calm me down. So I will see my psychiatrist tomorrow. One of the things about my psychiatrist is he's a resident, which means he's certainly a medical doctor. He has a medical degree and he prescribes all my medicines. But residency is a part of training in the medical field, and he's going to be moving on to the next phase of his career, which means he's advancing to a different type of job as a psychiatrist. And I will lose him as my psychiatrist, and they will either assign me to one of the more permanent psychiatrists at my clinic, or they will transfer me to another resident for the next year or 2 years. This is nothing new. I've gone through this 4 or 5 times. I've been in the same clinic for several years, and my psychiatrist changes every so often. And I believe my psychiatrist said he was going to leave in June or July of this year, so soon, because it's April now. It's April 20th. So I will have to get used to a new psychiatrist. I did not go to group therapy over the past few weeks and the next few weeks because of all the medical appointments I've had and getting ready for knee surgery. it just made it impossible to keep a weekly schedule of going to group once a week for 8 weeks. Once the surgery is done and I recover from surgery, then I will return to group when it starts up again. It starts up on a schedule, and I'm missing that schedule right now because of the surgery and all of my medical appointments. So I do kind of miss group therapy. It was very helpful. Overall, I've been doing good in terms of not going to the psychiatric emergency room. I haven't been there since October 30th of last year. So it's been November, December, January, February, March, April, about 6 months that I've been able to avoid the psychiatric emergency room. And that's probably due in part to the fact that up until that point I didn't have a psychotherapist. So I was just seeing a psychiatrist. And I wasn't going to group therapy either. When I started group therapy and I started seeing a psychotherapist, I stopped going to the psychiatric emergency room. It became less, I don't know what the word is, less necessary. I just didn't feel as bad enough to go to the psychiatric emergency room. Even when I felt really bad, I didn't go because I had more support systems around me. So, in preparing for my surgery, since I might be laid up for 2 or 3 days, I just went to the store and bought supplies. So make sure that I have all my over-the-counter medications that I need, that I'm picking up all my prescriptions ahead of time, that my laundry is done, that my apartment is cleaned. Because once I'm on crutches, it's going to be kind of hard to do any of those things. So I'm going to do them ahead of time. Make sure I have all my supplies, my food, my medicines. Make sure the laundry's done. Make sure the apartment is clean. Because I may be several days where I can't move around very much because of my right knee being operated on. Physical pain is unavoidable. I have to walk on this knee. It's difficult, but I've been through surgery before that was painful. This is nothing new to me. I broke my wrist once, and I have metal screws that were put into my wrist about 10, 13 years ago, something like that. And the screws are still in my wrist. They were never taken out. But that was a pretty painful experience as well. I took, I forget what the name of the drug was. It was an opiate mixed with Tylenol, Percocet. I took that for about a month. I didn't get addicted to it. I didn't ask for more of it when the prescription ran out. Opiates, like I was telling my therapist yesterday, were never my drug of choice. When I did abuse drugs, it was either marijuana or speed or both, and alcohol, and cigarettes, and caffeine. But the opiates were never my drug of choice. I don't think there's any danger of me abusing opiate drugs. But that's all that's going on for right now. I'm doing better today than I was yesterday. And I'm just preparing to get ready for surgery. And I just want it over and done with so I can move on with my life.